Oklahoma set a new record this week for COVID-19 cases. On Monday, the state health department reported more than 28,000 new cases over a 3-day period.
Now, in Tulsa County, most zip codes are in the severe to extreme risk category, citing more than 1,400 new cases in the first week of January. Tulsa Mayor G.T. Bynum is joining us this morning to talk about those surge in cases. Thanks for being here, Mr. Mayor. Let's talk about just kind of the overall assessment. How are we doing here in Tulsa when it comes to COVID?
Well, I had a meeting yesterday with my colleagues on the council and with Tulsa Health Department leadership. And as you say, I mean, the case numbers are very high. The guidance that we're receiving continues to be the same, though. People have to get vaccinated if they aren't already. Unless you have a medical reason to not be vaccinated, there really is no excuse at this point. You know, this is really, we hear the case numbers and see the impact of it, but the reality is that it's a tale of two cities between the vaccinated and the unvaccinated. The levels of hospitalization, the vast majority of those continue to be unvaccinated people, and the mortality rate continues to be heavily tilted towards unvaccinated people. And so, there are a lot of other areas of guidance out there from the CDC and others that I think a lot of the folks I talk with are frustrated by an inconsistency there. There is no lack of consistency with what I am hearing from medical professionals, though, that everybody that can be vaccinated needs to get vaccinated. And my hope is, and the good news, if there can be good news as we see these numbers climb, is that the folks at Tulsa Health Department tell me that they are seeing an increased number of people getting vaccinated as this newest variant is a reminder that this pandemic is not over, this virus has not gone away, and that if people want to protect themselves from the worst impacts of COVID-19, the best thing that you can do to protect yourself, your family, and the people you care about is to get vaccinated.
There's a big demand for testing, Mayor, right now. Some people waiting in line for hours. Is there something you could think that the city could do to help alleviate the testing backlog? I know we have ARP, the American Rescue Plan Act. Is there something the city can do in terms of testing?
Well, the challenge is that this is not something that is localized to Tulsa, and this is something that I discussed with leadership at the White House 2 months ago now at this point, that we were already seeing a shortage of testing supplies in Tulsa, and that was before even there was talk about having a national mandate for employers relative to testing for unvaccinated employees. And I was assured at the time that, well, we have the Defense Production Act at our availability. We could utilize that to increase testing supplies. But we're 2 years into this pandemic, and we are still short of the number of testing kits that we ought to have as a community and that I think we ought to have as a state. And so my hope is that you will see an increased production of testing kits, not just for us here in Tulsa, but nationally. I think every major city in America right now is dealing with this challenge of a shortage of testing kits. If I have one thing that I would ask of Tulsans, though, is if you need testing, please call the Tulsa Health Department and talk with them about where you might be able to access it. Do not go to an emergency room. Our hospitals are already heavily burdened and have been throughout this pandemic. Going to the ER just to get tested is something that isn't necessary. There are other places and other opportunities. You may have to wait a while to get your testing results or to even get tested, but going to the ER just to get tested, especially if your symptoms are not severe, is putting a further burden on our hospitals and our emergency rooms across the city.
Well, and a big challenge is for employers, and I know the city's facing this as well, but when employees are sick or have to be out or have the protocols in place not to go in because they've been exposed or been near somebody, I mean, this is really causing some significant problems in trying just to do the work flow from day to day.
And this is exactly what I told the folks at the White House about why I was not supportive of a national mandate, not because of philosophical reasons, but because of just practical reasons that I did not believe at the time. And it's certainly proven to be the case. We just do not have enough testing supplies to have that sort of requirement in place. And so now with this variant hitting our community, you're seeing the reality and the implications of not having enough testing supplies. But again, industry has proven itself very efficient, especially when you talk about production of the vaccine. My hope is that we will see the same happen with production of more testing supplies. We need them.
Mayor Bynum, thank you very much for your time today.
Thank you.